Welcome to the Human Capital Innovations Podcast. We're your source for personal, professional, and organizational growth and development, where we share original research, explore industry trends, and interview executives and thought leaders from across the globe. We hope you join us often for practitioner-oriented content around all things related to leadership, HR, talent management, organizational development, and change management. Maximize your personal and organizational potential with Human Capital Innovations Podcast. Do you enjoy the Human Capital Innovations Podcast? Please subscribe, leave a review, comment, share, and consider supporting the podcast on Patreon, even at the producer and sponsorship levels. Welcome to the Human Capital Innovations Podcast. In this HCI Podcast episode, I talk with Dr. Anthony Harris about how businesses can have workplace safety within the realm of new COVID strains and mandates. Dr. Anthony Harris, welcome to the Human Capital Innovations Podcast.
Thank you so much, John. Thanks for having me.
It is a pleasure to be with you. You're joining us from Chicago. I'm south of Salt Lake City in Utah. Today, we're going to be talking about the pandemic. We're going to be talking about how businesses can have workplace safety and increase workplace safety within the realm of new COVID strains that continue to come about and the mandates that may or may not follow. So over the last couple of years, of course, we've been dealing with this. There's been new strands. There's been new issues related to just dealing with the number of cases and hospitalizations and such. With that have come mandates, mask mandates. Some companies have had vaccination mandates, and all of the social and political tensions that come along with all of that. So this has been a big, messy thing for 2 years. Now it feels like, at least around here in Utah and many people I'm talking to from around the country, it feels like most people, are of the mindset that we're kind of past this. We're past the pandemic stage. We're into the endemic stage. And that it's not something we really need to be thinking tons about. Yet there's still yet another new strand. There's warnings that we could see another surge in cases. And so I think this is going to just be something we continually have to think about. And whether we're talking about COVID specifically, or we're just talking about any workplace safety and health related issues, I think much of what we're going to discuss today still has that application. So Dr. Harris, it's a pleasure to have you. And I appreciate you spending time to share your expertise with me and my listeners. As we get started, I wanted to share Dr. Harris's bio with everybody. Dr. Anthony Harris, MD, MBA, MPH, is the owner of HFit Health and the former Chief Innovation Officer and Medical Director for WorkCare. He is board certified in occupational and environmental medicine and is the former Medical Director of Community Occupational Medicine, LLC. He has worked as a healthcare consultant with a focus on market research, product design, and business development since 2006. Dr. Harris earned his medical and master's of business administration degrees at the Indiana University School of Medicine and Kelley School of Business, and his master of public health degree at the University of Illinois, Chicago. He has general surgery training, and he completed fellowship training in biodesign and innovation at the University of Missouri. What a tremendous background. Again, a pleasure to have you. Anything else you would like to share with me or my listeners, just by way of your background, personal story, before we launch on into the conversation for today?
Well, hey, thanks again, John. And I'm a fervent tinkerer, I'd like to say, so the bigger the problem, the more we jump into it. And certainly during COVID, serving as lead physician for WorkCare to help save lives and protect workers as much as we could.
Yeah, thank you. And obviously within the medical field, talking about workplace safety in hospitals, in care centers, and those sorts of things, that's an entirely different level, right, of really everything that we're going to be discussing today. But there's application, of course, to every workplace. And I think pretty much everyone listening has had to wrestle with that over the last couple of years. So why don't we start with you just laying out, your overall framing and a landscape for the current conditions and where you see things going in the coming months and year.
Sure. So in terms of dealing with COVID, right? I mean, this is part of a more global picture, obviously. And if we look at history, and I mean, look at history, right? Let's go back to the first recorded pandemic in 900 BC, right? And since then, if we look at the occurrence of pandemics globally, they've accelerated in terms of their presence here on the planet, right? And it makes sense. We are increasing our population, our global population, and that brings with it the opportunity for more transmission of illness, right? And as we look at the history of COVID, we began with a prognostication that COVID's going to be around for at a minimum 5 years. We're obviously not through much of half of that, right? We're at that halfway mark, if you would. And so there's still a long runway to go. And so what does that look like for us? Obviously, we know what it's been in terms of the strong lockdown, social distancing, mask mandates, vaccine mandates, et cetera. And in particular, as we talk about protecting the workforce, what is that going to look like? Unfortunately, it's going to be much of the same. And that's part of what we're seeing today, because we're not just talking about trying to prevent loss of life, right? Obviously, that's a central component to what we do, what I do as a public health official and public servant in the healthcare industry. But we also have a charge in occupational health to help minimize what's called absenteeism, the loss of the workforce from the workplace as a result of illness. And so we're still seeing a significant impact to absenteeism as a result of COVID-19. And that's what's going to be the most pressing thing for us to solve as we continue to deal with COVID over the next 2.5 years.
Yeah, thank you. Well, and as much as I've tried to stay on top of these issues, as you've shared this 5-year benchmark, I'm not sure I'd actually been aware of that. So that means, yeah, we're less than halfway through. We still have a long way to go. Hopefully the worst is behind us. But you know, it's all uncertain and unforeseeable. So we still have to be vigilant in making sure that we're taking precautions. And, you know, just last week, I had a good friend who tested positive for COVID. You know, he's been super careful. He's been vaccinated. He's been boosted, and he ended up having a pretty tough case. And so it's still happening. You know, hopefully it's not happening as often, but it is happening. And so we still need to be careful. And you mentioned absenteeism. So clearly workplace illness, workplace safety is key. But one thing that organizations have had to do over the last couple of years is, you know, in many cases, when possible, go remote or hybrid, or just provide increasing flexibility to employees and accommodations to employees. And I think those trends are going to have to continue, if for no other reason than employees just expect it now after experiencing it for a couple of years. But within medical care facilities, hospitals, it's not like you can just zoom in to be a nurse and take care of people. And so there's going to continue to be challenges. Serious illness, even death, obviously that's horrible. But like you said, absenteeism or even serious illness, that's one level. You talk then about absenteeism that has negative impacts for both employees and for organizations and for those they're caring for example, if they're healthcare providers. That's another level that we have to pay serious attention to. But then you have other things like withdrawal cognition, where you're still showing up to work, but you're really not as committed to it. And frankly, you're kind of tuned out and you're actively looking for the next thing. And we know right now in the middle of this great resignation, the great reevaluation or great reawakening or whatever, however you term it, that's actually a super common problem that organizations are facing as well. So even if everyone is physically healthy, mentally, people are feeling burdened, they're feeling overwhelmed, they're feeling burnout, everything they've had to deal with the last couple of years. And frankly, people are just reevaluating and saying, is this something I actually want to do? And so the amount of productivity happening in the workplace, while people may be butts in seats, are they actually actively engaged in the work that they're doing? And we've seen a decline there. So all of these different factors go into what we're trying to create. And that is a dynamic workplace environment where it's healthy, psychologically healthy, socially healthy, physically healthy as well, where we can meet the needs of every employee. And that's really what organizations are struggling with. I'm not sure we figured it out yet.
I think you're right, right? It's an ongoing or evolving process in terms of protecting the workforce from those things that you mentioned, right? The burnout, the mental fatigue, or psychological feeling not psychologically safe, if you would, in the workplace anymore. And the statistics and the studies have held up to what we're seeing play out in the workplace. In that, it was estimated about 40% of companies would not go back to an in-office setting. And they would continue to have remote work in perpetuity. And there's been studies that have demonstrated that productivity for remote work actually increased across sectors. And so that's why you're seeing, the announcements of, the entire company, like Airbnb, right, remotely capable now moving forward. Now, exactly what you're talking about also is playing out in regards to individuals being at work but not being as productive because of their mental status, and that we call presenteeism, where you're there but you're not 100% there, right? And productivity has taken a hit as a result. And companies, like you mentioned, are still trying to figure that piece out. How do we re-engage the workforce? How do we put purpose, where purpose may have been waned over the pandemic because people were not centralized, right? They didn't have that motivational conversation with their neighbor next door, or from the manager or the boss, right, to help keep the team rowing in the right direction. Managing the remote workforce has its challenges, right? And so as people are trying to come back to work safely, there are new challenges in terms of that motivation, that engagement. And frankly, as we're talking about, if we zoom out, if you would, and look at kind of some of the larger macro challenges that COVID-19 has presented, as well as highlighted other problems with regard to employee motivation. It's around what we call total worker health, right? Really looking at how do we keep the workforce healthy, literally, physically, right? Almost half of the U.S. population suffers from obesity, right? Our diabetes off the charts, and these are things that have worsened during the pandemic. Right, chronic illnesses that have worsened during the pandemic as a result of stressors, as a result of people not being out and about, exercise being down, self-care being down, right? And so now we have, on top of where we were pre-pandemic, a confluence of these health issues that it's burdening the workforce and our population. And we're struggling to keep up, if you would, with the demand for innovative ways to re-engage, to motivate, and then get people back on a path of kind of global safety through health and wellness, if you would. Right.
That's a really good point, and I'm glad you bring up the broader wellness discussion here, because I just think about myself, and I assume anyone listening, you think about how this applies to you. Everyone's different, obviously, but I went from I worked in a hybrid arrangement for years. I've done that for years. So, I've worked from home a lot already, but during the pandemic, it went, 100% virtual. And so I'm just not doing the normal little things. I still get out and walk my dogs and do those sorts of things, but I wasn't going into the office. I wasn't just walking to the car, walking from the car to in the parking lot to the building, walking around the building to go to meetings, just things like that. I noticed, like many people, I keep a fitness tracker, on me. And so I can just see how my steps are. For years, I've averaged, a certain level. I'm usually around 15,000+ steps a day without any particular, effort towards it. That's just kind of my normal day of how I move around and walk the dogs and work and whatever. Immediately I saw that like dive in half. Right. So these are just little daily things that happen. I'm not giving thought to it. It's not like I'm going to work out. It's just that I cut in half that movement. And so you multiply that across the entire population. And it's no wonder all of a sudden you see an increase in these chronic illnesses and pain and obesity and diabetes and all these things. Now, I found myself having to be extra vigilant about scheduling time to get more physical activity. And it's one thing to have a workplace wellness program, when people are coming into the office and you can have messaging around the building and there's like a location people can go to and we can have like walking meetings and those sorts of things. It's one thing when we're together, but when we're working virtually and we have a distributed team, employee wellness is still super important. But how do you foster a culture of employee wellness, physical wellness, mental wellness, when people aren't even together? How do you encourage members of your team to make sure that they're taking regular breaks and to get up and move around and to stretch and to just do those basic things? How do you get people to do that? And that is, I think, as you mentioned, an ongoing challenge that we haven't quite figured out in relation to everything surrounding this pandemic. And let's also just, as a reminder, and I don't mean to be a downer here, but you said we're about halfway through what many people said was going to be the cycle. Welcome to the Human Capital Innovations Academy. Courses, micro-credentials, and certificates to upskill and reskill for the future of work. All HCI Academy courses, micro-credentials, and certificates are designed, developed, and delivered by award-winning and internationally renowned scholars, educators, thought leaders, executives, and practitioners. Our courses, micro-credentials, and certificates will help you make your mark on the future of work and make an immediate impact in your organizations. Check out the HCI Academy and our many course offerings and certificates to upskill and reskill for the future of work. Check out our new weekly LinkedIn newsletter, Alchemizing Human Capital, exploring industry trends via original research and interviews with executives and thought leaders from across the globe. We look forward to having you join us. Check out Human Capital Innovations magazine, Human Capital Leadership. Human Capital Leadership is a free, interactive e-magazine with the mission to help individuals, leaders, and organizations find innovative approaches to maximize their human capital potential. We publish issues quarterly in August, November, February, and May. Take a look at the latest issue and let us know what you think. Prior to this pandemic, many people had been predicting that we would see in the coming years major global pandemics, and this isn't the end. Like, this is one that we're experiencing, but the next one could be just around the corner. And so, due to a variety of reasons, that's something we just have to stay vigilant about, and we do need to figure this out sooner than later, so that we don't have not only a workplace wellness crisis, but that we don't have a societal wellness crisis. And the other aspect of this, you kind of alluded to it, but I'll just put a fine point on it, is that we've seen the pandemic impact different groups and populations differently, right? And so there are certain disadvantaged populations that have had worse health outcomes during the pandemic, not only just from COVID itself, but from all these derivatives, that you've already been talking about. And so these are additional layers of complexity around this issue that we just have to continue to pay attention to.
100%, right? 100%. And if you look at, kind of adding insult to injury, right? The things you just mentioned in regards to why the underlying problem of why people have experienced increases in chronic illness, particularly around obesity and diabetes. We now add to, like you said, the disproportionate effect of COVID on different populations, right? Not just the underserved, but those with underlying chronic illness, right? Unfortunately, here in the U.S., over 40% of those who lost their lives to COVID were diabetic. 40%, right? And now we're increasing the number of diabetic individuals. And as you mentioned again, the next pandemic, we're not through this pandemic yet, But now we are more vigilant, looking for what's next, right? If you look at the occurrence of this present week and last week, and the emergence of monkeypox, right? Being now on the scene here in the U.S. With one case in Canada, UK, Spain, Portugal. We're looking at that and saying, okay, what is happening that we're now seeing a virus that was extremely rare and not transmitted human to human from animals. It was a zoonosis disease from animal to human primarily. Now we're seeing it morph potentially and transmit human to human, right? And so again, on the lookout, on the caution for another pandemic that may be upon us. I'm not, trying to say anything doomsday ish, if you would, but again, it's just it's a telltale sign that we need to do more, perhaps, to address some of the underlying factors that put us in a position of increased susceptibility for transmission as well as for poor outcomes, so that the next pandemic doesn't hit us as hard as COVID has.
Yeah, great. And let's go there next then. So what are some of those things that we need to be doing now so that we're not caught flat-footed like pretty much most people were back in March of 2020? There were some people that were ready to pivot on a dime, but most people were completely caught flat-footed. So what do we need to be doing to prepare to respond to future issues and challenges, whether it be just a new strain of COVID or if it's a new virus altogether? What are some of those things that we need to be looking at right now?
Sure. Well, there's kind of twofold to that, question in regards to what can we do as a society at the governmental level, and then what can we do at an individual level, right, or an organizational level. And certainly, we saw swift, active activity from the government, and again, mentioning monkeypox. We saw recently the government order a magnitude of smallpox vaccine, which is 85% efficacious against monkeypox, right? And so recognizing that vaccinations will save lives, recognizing that not delaying and being prepared with enough vaccinations is paramount to helping minimize effects from any potential virus or pandemic vectors. And so we see that happening on the individual or organizational level, right? Having a plan in place, right? Having a rapid response plan, so that if there is a local or a regional or even nationwide outbreak, your organization can respond quickly with the things that we know will be protective for that particular vector, right? If it's airborne, obviously masking. If the means of transmission is fecal oral and whatnot, the hand hygiene protocols in place. So again, it's a partnership between public health organizations and governmental organizations, so that plans are in place and the resources are there. That's important, right? You mentioned we were caught flat-footed, not just on our response, but on our resource allocation, manufacturing of enough personal protective equipment, et cetera. And I think because now we've endured COVID-19, we'll be more prepared, better prepared with these plans. The telltale sign will be how we will respond, not to the very next pandemic, right? But to the pandemic that's 10 years away. Will the institutional knowledge and will the history that we hopefully learned from persist in our responsiveness a decade from now, right? That'll be the test. And so we'll kind of wait and see. But for now, planning is going to be key.
Yeah, I hope we're ready. I hope, we don't forget the lessons that we've learned these last couple of years. Well, Anthony, it has just been a real pleasure. I know at the time we're going to have to wrap up here in just a few minutes, but before we close for today, I wanted to give you a chance to share with listeners how they can get connected with you. Tell us a little bit more about HFit Health, and then give us a final word on the topic for today.
Sure. So please reach out to me if you have questions. You can reach out to me on Twitter. Dr. Anthony Harris is my handle. And then you can visit HFit Occupational Health, HFit Health, just at hfithealth.com. You can get a hold of me, my team. Our mission is to help prevent not just workplace transmission, but also in the population, right? That we want to make sure that we have a healthy population from now until That's my training, that's my expertise, and that's what we provide to communities as well as organizations with that forward-looking technological bent to everything that we do. And the word for today, I would say, is really personal, let's call it personal protection, right? Or a personal charge, right? And I'm not just meaning, are you vaccinated? I'm not just saying, are you still masking? What I want to put forth is, how are you thinking about your own personal health, the health of your family, from an overall standpoint of, underlying chronic conditions, diabetes, obesity, mental health, right? And taking time to really create a plan to understand the state that you're in and move towards a better state of health. And if we all, improve only just one aspect of our current state of being, we're going to have a healthier population overall. And what we will find is that our society, our communities will thrive even more. We spend a lot of money on healthcare. Number one in the world on healthcare spend. Last time I checked, we were 47th in the world in terms of good health outcomes, right? And so that's where we want to really focus in on our individual charge to be healthier from a physical and mental standpoint, and everything around us then will improve. And that, again, is our mission at HFIT and the communities that we serve with our franchises of clinics.
Wonderful. Thank you so much, Anthony. It has been a pleasure. I encourage listeners to reach out, get connected, find out more about what Anthony can do for you. Check out HFIT and his team. And as always, I hope everyone can stay healthy and safe, that you can find meaning and purpose at work each and every day. And I hope you all have a great week. Check out my new book, The Future Leader: Creating and Transforming Next-Gen Organizations. Stemming from 2 decades of professional experience and over 600 in-depth interviews with executives, thought leaders, and scholars from across the globe, The Future Leader will help you explore the ordinary, everyday actions that will help you to prepare to lead in the future of work, to respond to an uncertain future, and to produce extraordinary results for individuals, teams, and organizations. Bluer Than Indigo Leadership: The Journey of Becoming a Truly Remarkable Leader. Early in my adult life, I learned about an Asian proverb that translates as bluer than indigo. If you think about the color indigo, it is a brilliant, deep, and vibrant blue, what some would call the bluest of blues. To have something that is bluer than indigo is rare and truly remarkable. Contrary to popular myth, there is no one-size-fits-all or cookie-cutter approach to effective leadership. There is no silver bullet, no secret sauce, no go-to model that will solve all of your problems. The truth is, great leaders have all had their unique strengths and flaws, and have all had to discover and then pave their own distinctive path in their life's journey to fulfill their leadership potential. Bluer Than Indigo Leadership will help you discover your own path and explore those ordinary, everyday actions that will help you respond to an uncertain future and produce extraordinary results for individuals, teams, and organizations. The Alchemy of Truly Remarkable Leadership: Ordinary, everyday actions that produce extraordinary results. Consider how the nature of work has shifted over the past 50 years. With increased globalization, rapid technological advancement, and the shift in economic composition, the average job of today looks very different than the average job of 50 years ago. What will the jobs and organizations of tomorrow look like? Moreover, what does this all mean for organizational leaders? What are the core competencies and capabilities of organizations and their leadership that are prepared for continued disruption and geopolitical and socioeconomic shifts? Regardless of what the future holds, increasingly, leaders need to be socially minded, data-driven, decisive, champions of talent, and disruptors of the traditional notions of leadership, teams, organizations, and work. The Alchemy of Truly Remarkable Leadership will help you to explore your own leadership competencies and capabilities and consider ways to apply and implement them into your workplace and personal life. Thanks again for joining us for this episode of the Human Capital Innovations Podcast. I hope you stay healthy and safe and that you have a great week.